As we get older, we get a little lumpy and bumpy, and the same goes for our cats. One of the most common calls we get into the hospital is, "I just found a bump on my cat. Should I be worried?" In this video, I'll chat about when it's okay to monitor that bump and when it's time to schedule that vet appointment. I'll also reveal the most common bump I am asked about. The answer may surprise you. Hi everyone, I'm Dr. Oz. So what do you think this bump is, Doc? Honestly, I stopped guessing a long time ago. As someone who biopsies a lot of bumps, there is no surefire way to predict what a bump is just by looking at it and feeling it. The only way to know is to collect some cells and look at them under a microscope. While we often use likelihoods and statistics to guide our decisions, I've seen too many surprises to rely on appearances alone. For many of you, once you find a bump on your cat, your mind immediately goes to cancer. When I'm looking and touching a bump, I am less concerned when that bump is white to pink, soft to the touch, superficial or just in the skin, not attached to anything under the skin, and there has been little to no change over time. A common example is what is known as a sebaceous adenoma, which is a benign growth from a gland in the skin, and these can pop up anywhere. They are generally small, only 1 to 2 millimeters in size, soft to the touch, are generally white to pink, can have a cauliflower or lobulated type appearance, are only in the skin, not attached to anything underneath, and generally do not grow. Many people refer to these as skin tags. If your cat is one, more may develop as your cat ages. Sebaceous adenomas are a rare exception to the rule that you can't diagnose a bump just by looking at it. They are common, and I've removed quite a few that have been confirmed with histopathology. This is one of the few bumps I'm comfortable saying it's okay to monitor. If a bump has some of these benign characteristics, I still may recommend removal, especially if it's irritating to your cat, if it's often licked or scratched, if it bleeds, if it becomes infected, or if it's in a problematic area. Now, if your cat's bump is soft and squishy, you might be dealing with a cyst or an abscess. If you notice a puncture wound and that bump popped up in a day or two, that's a clue it might be an abscess. Cysts, on the other hand, don't really change size that quickly. Either way, your vet will probably recommend sticking a needle into the bump to identify the fluid. Don't try this at home. If you notice a soft and squishy bump on your cat's ear, that's probably going to be a hematoma. That bump is filled with blood because a small blood vessel burst open while your cat was shaking their head, usually in response to an ear infection. Here are some bump characteristics that start to get me a little worried. The color is blue or purple. It's firm or hard to the touch. It doesn't move easily with the skin, or it seems to be attached to underlying tissue, or there's a rapid change in color, size, or shape. Certain locations are going to be more suspicious than others. A bump on the chin, I'm thinking a scratch or acne, but a bump near a mammary gland, I want that off now. Why is that? A bump near a nipple or a mammary gland is oftentimes malignant, especially in a female cat that was not spayed before her first heat. Just in case you weren't aware, if your female cat goes through a heat cycle, the risk for mammary cancer goes up significantly. So make sure you are spaying your cat before their first heat cycle. Do not wait till 6 months of age. When it comes to figuring out what that bump is on your cat, we have 3 options. The first, fine needle aspiration. That's where we stick a needle in the bump and get some cells. This is pretty quick, relatively pain-free, avoids heavy sedation or anesthesia, and is the least expensive option. However, the actual diagnosis can be missed with this method. The needle may miss the bump. The small number of cells collected may not actually represent what is in the bump, and some tumors don't exfoliate or release their cells easily, making diagnosing with a needle challenging. Option number 2 is a true biopsy. That's where we get a bigger portion of the bump with something bigger than a needle. The limitations of the fine needle aspirate decreases as we get more cells and a better chance to get an accurate diagnosis. However, we lose some benefits. It's going to be more expensive. It's going to be more painful. It generally requires heavy sedation or anesthesia and may require a short stay in the hospital. Option number 3, my personal favorite and the one I recommend most often, surgical removal of the bump with lots of surrounding tissue. Obviously, this is the most aggressive and costly option, but for me, it's the fastest way to get to the answer and sets us up the best for the future. One of the reasons why I choose option 3 is if we are dealing with cancer, early surgical removal with wide margins, hopefully 2 to 3 centimeters of healthy tissue around the tumor, gives your cat the best chance for a positive outcome. But in some areas of the body, there simply isn't enough cat to achieve those margins. That's why early detection and removal is everything. And for many cancers, surgical removal with wide margins is better than any treatment, including chemotherapy. Location and how the bump looks may be a factor in which option we recommend. If I have an enlarged lymph node, I'm generally recommending a fine needle aspirate. However, if I have a bump near a nipple or a mammary gland, I'm generally recommending option 3. I want to surgically remove that bump with wide margins because I know a decent percentage of bumps in that location will be cancerous. Let's chat about the most asked about bump on Reddit and at the hospital. The nipple. They are small, like a millimeter in size, pink or flesh colored, flat or slightly raised. They may become more prominent during a pregnancy. They are typically hidden by the fur, usually difficult to see unless your cat is shaved or has short hair. Both males and females have them. On average, 6 to 8 on both sides of the midline on your cat's belly, typically across from each other. I've shaved enough cats to know many cats will have a random nipple somewhere on their belly that looks exactly the same as a normally placed nipple. Some cats get a thick material around the nipple and the nipple can invert almost like a pimple. This can give a different appearance to the nipple and your vet can help diagnose and treat these oddities. One final point that I cannot stress enough. If you are worried enough to biopsy or remove a bump, make sure you have it tested, specifically with histopathology, so you know exactly what you are dealing with, even if it turns out to be benign. If another bump with similar characteristics pops up in the future, you can rest a little easier. Even if it turns out to be something more serious, we still know what we're dealing with. We'll know a prognosis, life expectancy, and can take the appropriate steps to move forward. So when in doubt, have your vet check that bump out. If you learned something, make sure you like, subscribe, and comment. Thank you so much for watching, and I'll see you on my next video.